And I'm going to do my final head-to-toe assessment for our nursing assessment class. First thing I would do is I'd walk into the room and introduce myself to the patient, make sure that he is assured privacy, introduce myself to the patient, talk to him, ask him his name, date of birth, and while I'm verifying that information. And while I'm doing this, I'm kind of assessing the patient's whether they're alert and oriented, their speech, their clarity, their mood judgment, as well as observing the facial expressions. Then I would do the vital signs, and while I'm doing my whole inspection, I would be looking at the skin. I would be noting any lesions, abnormalities, the turgor, the moisture, while I'm doing the whole assessment. I would palpate the skin, and I would notice any changes anywhere, and I would make note of that. First of all, I would make sure the patient wasn't in any pain, and then I would begin my assessment. All the while, telling him what I'm doing as I'm going through and letting him know to let me know if there's ever any pain or discomfort with what we're doing. So first of all, I'd start with his head, and I would inspect his head, and I would note the shape and size, if there's any lesions, bumps, or bruises, or tenderness. I'd note the hair, the color, the texture, as well as the distribution. Then we can move on to the eye assessment, and I would have him open his eyes, and I'm going to look at the sclera and note that it's clear if there's any discharge from the eyes. And I would notice that that his pupils are equal, round, reactive to light. I would make note of the extraocular movements of the eye and have him follow the pen light to watch his gaze to make sure everything is equal. Next, we can move on to the ears, and I'm going to look at each of the ears, and I'm going to note if there's any drainage, lesions, or tenderness, as well as any nodules within the ear. Also, we wouldn't do a hearing test, but I would know through my assessment with the patient whether or not his hearing was appropriate. Then we would move on to the face, and I would note, have him smile, raise his eyebrows, and all the while I'm noting symmetry, have him blink his eyes, and stick out his tongue, move his tongue from side to side to note for symmetry where we're observing the cranial nerves. Then I'm going to look into his mouth, see if there's any loose teeth, whether he has dentures, if there's any lesions, thrush, or anything going on within his mouth, if it's pink and moist as it should be, and if the tongue is pink and moist. I'm going to look at the nose and inspect both of the nares and see if there's any lesions or drainage to make sure that each of the nares is patent while I'm inspecting the nose. From there, I can move into the pharynx and just say, ah. Okay? And then we'll move on to the neck. With the neck, we're going to feel for all of the lymph nodes. I'm noting to see if there's any enlargement or tenderness of the neck, of the lymph nodes. And then we can inspect the neck. I would also ask him to shrug his shoulders to test for symmetry as well as strength. We can check the trachea and the thyroid gland. We're noticing for any kind of enlargement or tenderness within this area. Okay. And then I would move on to the post-thorax. I would have this patient sit up, and I would inspect the shape of the thorax. I would note any deformities. I would make sure there was equal excursions on both sides, any retractions. I would notice the skin of the back, as well as I would palpate the back for tactile firmness. I would auscultate each section of the lobes of the back to listen for symmetry from side to side, as well as any adventitious lung sounds. Then I would do the same on the front, all the while maintaining privacy. I would inspect for any lesions. I would inspect for symmetry and tactile firmness. And then I would percuss each of the fields of the lung. And then we would also take each of the lung fields, asking the patient to take a full breath as you move through, listening to each of those lung sounds. Again, we'll listen for adventitious lung sounds of the patient. Okay. Then we move on to the cardiac. From the cardiac, I'm going to inspect the anterior chest wall for the presence or absence of any pulsations or heaves. Then I'm going to listen to the cardiac sounds over all four areas of the valvular areas, with both the bell and the diaphragm of the stethoscope. And then I would listen to the apical pulse for 1 full minute. I would also palpate each of the carotid arteries one at a time. as well as auscultate with the bell of the stethoscope for a sign of bruit. I would palpate the radial pulse, and I would palpate the posteriotibial pulse, as well as the dorsal pedal pulse and the posteriotibial pulse. I would do that with each symmetry with each foot. If I was unable to palpate the pedal pulse, I would use a Doppler if necessary. If you have a lot of edema, you wouldn't be able to palpate that pulse. Also going to look, also in the area of the legs while I'm doing a cardiac assessment, I'm going to look for any signs of edema in the lower extremity and note if I have any edema in the lower extremity. And also I'm going to check the nail beds for color and cap refill for the fingers as well as at the toes. Cap refill less than 3 seconds. Next we're going to move to the abdomen. I would have this patient, I'm going to make sure I maintain privacy with the patient, but I would prefer the patient to be laying completely flat to inspect the abdomen. First, we're going to inspect the abdomen, look for any abnormal signs. We're looking again for symmetry, color distribution, and as well as tenderness, or not tenderness on the inspection, but we're inspecting at this point. Okay. Then I'm going to listen. I'm going to listen for the presence of vowel sounds in all 4 quadrants. And then I'm going to also check for bruit over the abdominal aorta, as well as the renal arteries. And I'm going to use the bell of the stethoscope to do this. I'm going to perform light palpation over the 4 quadrants, determine if there's any presence, if there's any tenderness or masses. Okay. Now I'm going to assess the musculoskeletal system. To percuss, yeah. Before I move on to palpate, I would percuss each of the 4 quads of the abdomen, and then I would also palpate for the abdomen for any masses or tenderness. Next, we'll move to the musculoskeletal system, and I'm going to ask the client to move his neck through all the ranges of motion. I'm going to inspect all of its extremities. I'm looking for color, symmetry, enlargement, and any deformity. We should have equal strength in both hands. Ask him to squeeze my hands, to pull, push with resistance. I'm going to palpate all the extremities for tenderness, temperature, muscle tone, strength, and I'm going to notice if there's any crepitus in any of his joints. I'm going to ask the patient to move all of his joints through the range of motions bilaterally, and I note the function of this. And we're going to move the shoulders, the elbows, the hips, the knees, and the ankles. And then we're going to look at extension and rotation as appropriate with the arms. Move to the neurological system. We're going to stimulate the deep tendon reflexes bilaterally to see if there's a response using the reflex hammer, if you had a reflex hammer. And we could do the popliteal and the brachial, look for reflex, as well as the ankle. We're going to observe for the strength in the lower extremities by having the patient push against for strength in the lower extremities. And also, if this were not a hospital patient, you would observe when the patient were coming to you, you would observe their gait and motion as they were walking to you. So you can also, as we did before, you would test the strength of the shoulder muscles by having them shrug against you. So, but in this case, I had the patient who's a COPD patient, and what you would focus on assessment of that patient would obviously be your respiratory system. You'd be noticed they may have dyspnea with this patient, shortness of breath. You could know cough. There could be mucus, excessive mucus with the cough, and you would want to note that, the color as well as the frequency of that. And you also would want to pay attention to the nail beds as far as oxygenation and possibly plugging from lack of oxygen. So basically that summarizes my assessment of my head-to-toe assessment for this class. Thank you.